Hey everybody, we're going to shoot this on location here at our new radiation oncology facility, Dr. James and JoAnn Bourland Radiation Oncology Facility. So we're going to give you a quick tour, and periodically we'll do updates here to show you the progress of construction. I'm going to orient you to where we are. If you can see over here, and I'll turn just a minute, the hospital's right there, so we're right across the room from the hospital. We are on the side of the facility that faces Oak Star Banks. This will be actually the main entrance for patients to come in to receive their care in the facility. So we're going to cut in and out on this video a lot. We walk through, we'll stop and give you some idea. Behind you will be the actual main entrance. We're underneath the canopy right now that allows for drop off for those patients to keep out of the weather. And then we'll make our way inside the facility here and show you a few things from the inside. Come on, me. Okay, so right now will be the actual door into the facility. So this wall will go right into the lobby. We'll make our way inside here, and I'll show you a few different aspects of the layout. It's going to be hard to really see at this point. You have to imagine as I walk you through things, you'll get a sense of how the facility is going to be laid out as we walk our way through. Come with me. Okay, so now we've made our way into what is going to be the lobby. So over here to my left, where the kind of entryway is going to be. We're going to have some wheelchair storage and some other things, and then over here to my right, this will be the actual waiting area. So there'll be a wall you can see there. Up you'll see the area where there's no steel. There'll be some windows in that area. So a lot of natural light will come through. And really on both ends of this lobby there'll be windows as well that allow natural light to come in. So let's make our way on through. Okay, so at this point we've made our way to the other end of the lobby. So behind me there'll be actually a courtyard, so a door that goes outside to a courtyard. Patients, their family visitors can wait outside if the weather's nice and they choose to do so. And this will all be open, windows, natural light coming through. Behind me you can see here there's a corner. Around that corner will be the public restrooms for patients and visitors and family lives. And over here to my left, we actually where the registration space is. We'll make our way on to the facility now. So it's going to be a little bit hard to tell at this point. We haven't gone very far from our last location. Over to my left, will be for patients to go enter into a dressing room to get changed before they go back into the linear accelerator. To my right, there's a small corridor here over here. When it's complete, there'll be offices, exam rooms, those type of things. We'll make our way around here to look at the vaults. Okay, now we made our way to the vault where the actual linear accelerator will be housed. You can see there's actually two doors, two different vaults. In this vault, let me Morgan. In this vault, you can see there's a wall. As soon as you walk in, the wall makes what's called a maze. That maze helps to limit the amount of radiation that goes beyond where the patient's being treated. And these walls are anywhere from 3 to 6 foot thick concrete all the way around, walls and ceiling both that contain that radiation. But this vault that you see here to my right, I'm pointing to, that has a wall that runs along the inside of that, forms that maze. And you look over here to the second vault, you'll see there is no wall there. So this will be our vault for future growth and expansion. When we open up the facility, it'll be nothing more than storage at this point. It will allow us to replace the technology at some point in the future, or to add a second linear accelerator if we need to. I'm going to take you all around this way. You can see all the stuff that's stuffed in right there behind you. This is where the CT scanner is going to sit. That CT scanner is really used to formulate the treatment plan for patients and help to map where they need their radiation to be applied. Okay, now we made our way all the way to the other end of the facility, and so this is the end to my left here that faces Everhard. So you can see we'll scan up here and let the beam that we signed for the top of the unit. It's a little bit hard to see probably in the video, but it sits right there at the top of this end of the building. So we've kind of walked our way through most of the facility at this point. Again, you have to imagine where walls are going to be. That should give you a sense of how the building is coming together. And as you watch these videos over time, you'll get to really understand how the construction project is going along. We've made great progress to this point, and we're on track, and really will continue to move forward with this project in hopes of being done. Construction in October and treating our first patient in December of this year. Thanks for following along today. Have a great week.